Good morning, class. We're going to talk about bloodborne pathogens this morning. It'll be for the afternoon class as well. So if I always say this morning, when I do this video that's applicable to both classes, AM classes and PM classes, I usually do it in the morning. I'm most creative in the morning. Well, maybe. So, but we're going to talk about bloodborne pathogens. I'm going to go through a book with you. I'm going to describe that. Now, you've already watched some videos related to the bloodborne pathogens. But I'm going to go through this book. If we were in person, this would be the book that I would give you. And it says all about bloodborne pathogens. I have to do everything in reverse. But it's all about bloodborne pathogens. So I'm going to go over this information with you. There will be a quiz that will be placed on your canvas and I'm not going to put it in every class, but if you've got 3 classes under me, like in the morning, there's Medicaid, Nurse Aid, Medical Math, and then there is Study Skills. In the afternoon is Principles of Health Science. Excuse me. For the first 9 weeks, we have Medical Terminology, and then we have Study Skills as well. This information is for the whole section. This is part of our going through our safety instruction for our classes. But I'm only going to post it to one class. There's no use for the redundancy. So we're going to talk about bloodborne pathogens. Now, we understand that there are microbes out there, and we are in this pandemic now, and we see what's taking place. We're wearing masks, we're wearing gloves, we're washing our hands. Those in healthcare settings are wearing PPE. PPE means personal protective equipment. So we're wearing our personal protective equipment to decrease or minimize or hopefully take care of any type of contact. If we're successful at that, then we're going to stay safe and well. If we're not successful with our PPE and our protocols that we have set in place, then we are going to, we may catch something. So that could be from a common cold to the flu to the coronavirus, to hepatitis, to AIDS, those kind of things. Now, sadly, you're going to have to watch me read just a little bit, and I know that's going to be extremely boring, but I'll try to make it as quickly as possible. Not too quick that you don't get the information. I will put the information up on the screen just in a little bit for each page that I'm going over. That way, if you wanted to, as you watch the video, if you want to stop, do a screenshot, and then go over the information, that would be available to you as well. The test is about 10 questions. Don't stress over the test. You're going to have unlimited attempts to take this test because it's not about pass or fail. It's about knowing the material so that you can be safe. I know there's some pass and fail things out there, and you've got to have a certain amount of knowledge in order to be able to pass those. And we will have exams later on in the year that'll be just like that. But we want a 100% pass rate on this safety exam, on these bloodborne pathogen exams. We want you to understand how to keep yourself safe. So if that takes 2 or 3 attempts, if that takes remediation and going back and rereading, because I find that when I don't do well on an exam or a quiz, I want to know why. And I go back and I read that information, and when I read that information, because I missed it, I'm not likely to miss it again, and it's likely to stay right there in long-term memory. All right, so what are bloodborne pathogens? You've got bacteria, you've got virus, and you have other microbes. They can be carried in a person's bloodstream, bloodborne. They're carried in the blood. It can cause disease, a pathogen, disease. For those of you who've had medical terminology, you understand that. For the afternoon class who will soon have medical terminology, you'll see that very shortly when we break words down as to what their meaning is in the medical field. If a person comes in contact with bloodborne pathogens, as long as our skin is intact, as long as, so let's say we didn't have anything and blood got on our skin, then it's not just going to seep through. But if we need to wash it off, we'd wash it off. But if we have a gown or we've got gloves on and it comes in contact with that provides a barrier for us for protection. Other substances that may spread bloodborne, other blood products, plasma, semen, vaginal secretions, fluid in the uterus of the pregnant woman, fluids surrounding the brain, the spinal cord, the heart, and also the joints, fluids in the chest and abdominal cavity. Some bloodborne pathogens can be deadly. And that's the reason we want to protect ourselves. Standard precautions can help us stay safe in these atmospheres, in these environments. I tell people, I remember back in the 80s when AIDS was a really big thing. I was one of the first nurses at Pikeville Methodist Hospital, which is now Pikeville Medical Center, to take care of a patient that was our first full-blown AIDS case. And I can tell you that we were very concerned with how this was spread. This was all new at the time. We double, triple gloved. We had shoe covers. We had hat covers. We wore eye protection. We had goggles. We had masks. We had the gowns. We would double gown. And it took us a while to understand what it took to take care of someone who had this disease process, who had this virus. And we also prepared, back in the day, we had a bath basin, and we would fill it with water, and it's supposed to be 1 to 10 part with Clorox, and we would have it 3 and 4 to 5 parts, maybe half. That's how concerned we were with spreading and passing this disease, this virus. Luckily, no one had any contact, no one due to this first patient. In our experiences in taking care of this patient, none of us got any contact. None of us came down with the virus or became infected related to this care. So if we take precautions, we can protect ourselves. Now, I said all that to say this: you're more likely to catch something at Walmart. Now, I may get sued for Walmart. These are videos, and sometimes I'm unfiltered. I just say what I mean. If you go to Walmart, now not so now in the pandemic, but how many of us touch a door handle? How many of us touch a buggy cart? Never thought anything about it. If you've got bloodborne pathogens, AIDS, hepatitis, and you get blood or contact, and you reach down and touch something, and then all of a sudden you're touching your face, you're touching your eyes, you're touching your mouth, you can contact that. If you come in, I've literally been into the Walmart bathroom and someone's went in there and there's been blood all over the place. I've seen that personally. Of course, I stay away from that. Let the person know that, hey, maybe somebody needs to come in there. We need a restroom attendant to take care of this. And they'll wear their gloves and they'll do everything that's necessary to take care of it. Do a great job. Got friends that work at Walmart, and they do a wonderful job. There are times, though, that we can come into contact with something. We went into a stall, touched the door. What's the dirtiest thing in a restaurant? The menus. Now, that's my opinion. I don't ever see them clean a menu. You pick up the menu, you're handling it, you give it back to them. How many people touch a menu? What if you had a cut on your hand? What if you were a diabetic who also had a bloodborne disease process or a virus, and you had pricked your finger, but then there was a residue of blood, and then somebody else, and then all of a sudden you're passing it? I don't do that. Don't say all that to make you paranoid, but we need to be cautious. We need to be cautious of the day and time that we live in. So, universal precautions, standard precautions. That we're going to treat everybody as if they have something, even if they don't. We don't want to treat anybody differently. We want everybody the same treatment, the same care, and by doing that, you're able to protect yourself. You're going to use the same precautions. You're going to respond how you're trained and how you practice every day. So, standard precautions are infection control procedures. They're recommendations by the Centers for Disease Control and Prevention, and they cover all exposure to blood, body, substance, and secretions and excretions except sweat, contact with broken skin and mucous membranes. Standard precautions expand on universal precautions. Universal precautions are covered by the Bloodborne Pathogen Standard that are developed by OSHA, the Occupational Safety and Health Administration. These apply to blood and certain body substances and are required by law for many workers, including emergency responders and healthcare staff. Those of us going into healthcare, we're covered under that. And we want to be sure that we follow the infection control procedures for our job so that we can stay safe. We don't want to take anything home. And that's the thing. We were concerned about taking something home to our family. And we don't want to do that as nurses. We don't want to do that as healthcare providers. We want to be there to provide competent, compassionate care for those that we come into contact with, and we want to help them when they are in most need. And they're in most need when they're in a hospital, they're having a medical emergency, some type of illness. They look to us, they look to the doctors and the nurses and all the healthcare providers, all the entire team, from laboratory to custodial to x-ray. It's just one big team, and we're there for the patient, and that's what we're supposed to be there for, is to help that patient. We want to bring them comfort, we want to bring care, we want to see them get better. Sometimes they don't always get better, and then we provide care not only to them, but that's extended to their family. And I guess that's the reason nurses right now during this pandemic are having such a hard time, because our patients are being isolated because of the disease process, and because we don't want them to get it, we don't want anybody to get it. And we have patients that are, the nurse is the only one there. They're not having family to be there to support them. And I hear some great things that nurses are doing to help those families and help that patient during this time. So I'm going to put, I told you I put this up on the board, so let me see if I can get it. All right, so there we go. Let's start. This is the first page. Please bear with me. I am new to all this technology stuff. This is the first time I've ever done this. But this will give you an idea of just what I went over with you. Gives you a little picture. This is the book that I use. All right. So let's move on. Thankfully, this book is only about 10 or 12 pages long, and there's two pages per section here. I thought that would make it a little bit easier. So let's take a close look at the three bloodborne pathogens that we may see the most. If you were born after 1990, you should have a vaccine for one of them, and that's hepatitis B. We started vaccinating children right after birth. It's given in a series of 3 injections, one at an elected date, then 30 days later, and then 6 months after that. And that will give you some immunity to hepatitis B. Dr. Mary Fox, wonderful doctor, wonderful lady here in Eastern Kentucky. She's passed now. She would come out and tell us it's probably the only vaccine that would cure cancer. Actually, our health department here in Pikeville was named after her, and she did a lot of work for the people of Eastern Kentucky to keep them safe. All right, so hepatitis B. Active hepatitis B, a flu-like illness that can last for months. You could become a chronic carrier state. The person may have no symptoms but can pass HPV. What can it cause? It's cirrhosis, liver cancer, and death. Unfortunately, or fortunately, vaccines are available to prevent this. So you have the opportunity. And again, to my students who I'm addressing this morning, you already have, or should already have, if you followed the guidelines and Borne since 1990, you should have the hepatitis B vaccine. Hepatitis C also attacks the liver. Symptoms of an active infection are milder than those of HBV, or may not even be present, but HCV is more likely to cause a chronic carrier state, cirrhosis, liver cancer, and death. I had a friend that had hepatitis C, and thankfully he was able to get a liver transplant. So able to help him. And there's others like that. We need, let me put a plug in here for organ donation. You know, somebody said, Mr. Justice, are you an organ donor? I don't have a sticker on my license, but when I'm done with everything, you can have whatever's left. And I'll give that freely. When I'm done, it's all yours. So I know that, but we're able to help other people by being a donor. The human immunodeficiency virus, HIV, and I was just made a mention there about AIDS a few moments ago. It attacks the immune system, making the body less able to fight off infections. In most cases, these infections usually prove fatal. So it's the secondary infection that gets you in those cases. How do these spread? Excuse me, they can spread through needle sticks, cuts, scrapes, any type of break in skin, splashes in the eyes, the mucosa. oral, vaginal, or anal sex, using infected drug needles. Pregnant women who are infected with these pathogens can pass them on to their unborn child. There are other bloodborne pathogens, such as syphilis and malaria, but your greatest risk are from hepatitis B, hepatitis C, and HIV. So let's go to the second page, or fourth page actually, and let me see if I can get this lined up. Please bear with me. I need a document scanner so that way I can show. My professor had one, Dr. Stanley at Moorhead, great guy. He had one, and he could just lay that there and you'd be able to see this. As we get more technologically advanced in our online and virtual teaching, we will get those toys, which are actually tools we need for teaching. And I want to say that I think the state and our county government and our Board of Education is doing a wonderful job. I know there's a lot of frustration right now trying to figure this out. And we want to have in-person classes. What's taking me, and I'm looking at the time now, 16 minutes, I could have covered in 5 if you were in person. You would have a copy of this pamphlet. I would go over the information, and in one 20-25 minute lesson, we would have covered all this, answering your questions as we went along, and then taking the quiz. With online virtual learning, if there's a big learning curve for me, and it's taking me longer, I'll do this video as I've done other videos. It takes me a little while, and it to upload. The upload is what I think I spent all day, more than all day, one day trying to get up 2 videos, and it's a challenge. And I understand you're challenged out there, with your internet connections, with the type of computers that you may be using or devices. But we'll take our time. We'll work together, and we will make it. So let's go next. Protect yourself from bloodborne pathogens. Autoclaves. Autoclaves are cool. They're devices that sterilize equipment. When we sterilize equipment, there is no pathogens. There is no organisms at all. Sterilization takes care of all organisms. There are organisms out there that will not harm you, that are non-pathogen, that if you come in contact with them, they're not going to cause disease. And then there are those that cause disease. If we use a sterilizer, such as an autoclave, there's nothing there. All microbes are gone. Biological safety cabinets are used to help protect lab workers from airborne particles. Special tools prevent needle sticks, such as the automatic. Of course, I grew up in a time when nurses, we pulled off the cap and there was no auto needle safety cap where it would pop back in and you had not an opportunity to stick yourself, which is awesome. But we've got those things in place now to protect healthcare workers. Special containers used for sharps, broken glass, or any objects. Those are usually hard plastic containers. And with those hard plastic containers, they've got a lid. Once you put them in, they get to a certain level, and there's a line on those plastic containers. You don't want to go above that line, and then you clip it. Generally, your custodial staff, your environmental safety staff, they'll come and they'll change those out for you when you need it. Back in the day, I remember we were in the ER, different places, they were running over. Anytime something is filled to capacity, it presents a problem and a potential for injury, not only to you, but also for patients and family that are coming into the room. So be aware. When you look at your surroundings, you walk in, where could be a safety risk? Where could I get injured? And we want to prevent that from occurring. Biohazard labels. Pay attention to those. Red bags, yellow bags. Usually yellow bags were for laundry. And some of them even dissolve. You throw them in. You throw the whole bag in. You don't have to even lift them up. You throw the bag in, put them in the wash. The bag will dissolve. I think that's pretty cool. I've not seen those in person. I've just been told about those. I'd say I don't know what the cost would be. Here I'm digressing. Forgive me. But we want to follow our work practices. We want to cover any cuts. If we've got a cut, like if I've got a cut on my hand, I want to wrap it, and then I'm going to use a glove to go over it. And we're going to talk about hand washing here just in a moment. But we want to handle anything very carefully. If there's glass, we want to use brushes and gloves and a plastic, and that just left me, that little dustpan, and just put it up. But we want to protect ourselves. We don't want to be cut. We want to keep food and beverages out. I think a lot of things spread. Well, things do spread hand to mouth. And we're out on the floor, we're working, we've got a lot of things going on, and sometimes we don't even have time to take a bathroom or a restroom break or get something to eat. I've worked through a many a lunch and a many a break in my 30-some years of time. And what do? We just reach over. Double quick, where everything is double delicious. All right. That used to be the commercial. Telling my age now. But we reach over. You know, we might have it at the nurse's station. We might have it, but here we've been in a room. We've been out. So we want to keep our food and our drinks away from our workspace in the medical profession. We want somewhere that's safe. We want to make sure that we're hand sanitizing in between, and we want to stay safe. We don't want to come out with doing incontinent care, forget to clean our hands, reach over, pick up our coffee, take a drink, set it back down, and go on. That's not good. That's a violation. So we don't want to do that. So we want to keep those away. We want, refrigerators, freezers, cabinets used for infectious material. They need to be marked. Generally, if you go into a healthcare setting, you'll have a big sticker on the freezer or refrigerator if there's things in there that could be dangerous. There's usually a separate refrigerator for staff located in the staff area. Don't eat, drink, or smoke in areas where bloodborne pathogens may be present. Don't handle contact lenses or apply cosmetics or lip balm in these areas. So I think that's important. My smoker friends, now I don't smoke, have no desire to smoke, but I've seen them, and those of you who know me, and I know that you smoke, and you're like, oh, he's telling on me now. When it comes to smoking, it's such a habit, and the next thing they know, they've left the patient care area, they've stepped outside to smoke, and they're doing this. And where's those hands going? If you don't have any hand hygiene in between, or if you're in that area, then you increase your risk of contact. Okay. So let's get this in here. I'm going to try to go just a little faster. I don't want to be too fast. Let me set that up there. Again, bear with me. All right. Gives you an idea. We'll just kind of take our time. All right. We're getting to the end. So, use required personal protective equipment. We want to wear gloves. Those gloves can have micro tears in them. If they break, we're going to take them off, get a new pair. We want to wash our hands. Even if we're wearing gloves and it's providing a barrier, we want to wash our hands or at least use hand sanitizer. I love this little guy. I thought that was so cute with the hands and stuff, the Purell. I got to purchase that several years ago to put hand sanitizer on my desk. And just kind of cute little hand sanitizer for Purell. I guess I'm doing a commercial Purell. But any kind of hand sanitizer. And of course you want to, rub it in until it's dry. We were taught back in the day, it's better to use soap and water. Matter of fact, when this hand sanitizer first come out, and they were putting it everywhere in the hospital, we're like, I don't know about that. But it does provide, if your hands are not visibly contaminated and you can't get the water, certainly you want to use hand sanitizer. You want to use hand sanitizer between each patient contact. We were taught that every 6th time we needed to wash our hands, not continually use hand sanitizer. After we've used that 6 times, we need to go to the sink. We need to wash our hands. I remember, I used to work for Licensing and Regulation, Office of Inspector General in Lexington and then also in Frankfurt back in 98 to 2000. Love that job. But one thing I saw when I would go into nursing homes right after hand sanitizer come out, you would see people go. And I'm like, you want to make sure that you rub it in. You want to make sure that you get a good amount and that you do it until it's dry. And also with the friction and the hand sanitizer, rubbing it in, hopefully we can kill the majority of the germs that are that can cause disease. I was looking here, and what it says right on the Purell says kills most germs. So it don't kill all the germs. It also says at the bottom, kills more than 99.99% of germs and leaves hands feeling soft. All right, there you go. All right, so we want to wear gloves. When we remove gloves, we want to sanitize our hands, whether that's with hand sanitizer or with soap and water. There's a proper way to remove gloves, and I'm going to do a video just on that. This one's going kind of long. I know that I'm going on. Again, it wouldn't last this long if we were in person, but I want to make sure and take my time, make sure that you get all this. Other PPE, eye protection. Now, these provide some type of protection, but you would want the goggles if you're going to get a situation where you're going to have splattering. Gowns, and also shoe covers in certain situations, hats in certain situations, especially if you're in the OR or in certain isolation conditions. Those are things that you can use. Anytime that you're, and those of you who have already learned, and those of you who will learn, anytime that you're doing CPR, you want to use a barrier device. Unless, if it's on your family and you know them, sometimes you don't even know your family, but if you know them, you can do mouth to mouth in emergency situations. American Heart Association, the other thing, if you don't have a barrier device, hands-only CPR until you can get a barrier device and help arrives. So, let me put this up real quick. Here we go. Maybe I'm getting a little better at it. Maybe I'm getting worse. Here we go. But that just kind of gives you an idea of what I was looking at and what I was reading from. You get to see the visual perspective there. Here we go. Get a couple more seconds. All right. We can eliminate hazards with proper housekeeping. Don't touch broken glass. Dispose of sharps. Place others' contaminated waste in appropriate containers. Never reach into trash. Don't reach in. You don't know what's there. Report all sharps containers when they're full, and wipe up any blood spills. Place protective coverings on work surfaces when they're visibly contaminated, and then of course clean those surfaces. And you'll hear some people say, well, I'm a nurse. That's housekeeping's job. No. When you go into that room and you've been assigned that patient, that's your job. That room is your job. That patient is your job. Every aspect of that patient. If that room's dirty, if that room's disorganized, as a nurse, when you go in there, of course, now I'm old school. When you go in, do a survey of the room. Look at the room. What do you see? Is there a sharp container in the wall? Is it full? If it's full, hey, make a mental note. I need to call somebody about that. And then when you go in, is there trash on the floor? Patients throwing stuff, they're trying to hit the garbage can, and they miss. I've done that before myself, missed. Put on some gloves, protect yourself, of course. Get rid of all, drop it in the trash, straighten the area, clean it up. If there's a visible spill, got your gloves on, grab you some paper towels, wipe up the spill. If it needs to be more in depth, of course, notify housekeeping, notify your custodial staff, and ask them if they can come in and help with that. This is going on, but help them too because they've got a hard job. Just because you're a nurse, that patient's yours, that room's yours, that room reflects you as a nurse. I've been assigned this patient, so thus by being assigned this patient, I'm responsible for that patient. I want to help that patient, and I need to help create a clean environment for that patient to get better in. So. That's my soapbox. All right, so we're going to do those things. All right, let me just put this right here. Well, let me fix it there. There we go. All right, let's move on. So consider, if you have not had the hepatitis vaccine, consider the hepatitis vaccine. I have the hepatitis A here recently. I hate needles. As I get older, though, they don't bother me as bad. Now, when I was a little boy, Dr. Harvey Page, Pikeville, Dr. Green in the building, I think Dr. Lauren Kidd, the nurse practitioners in that building now, they hated to see me come in. Now, Dr. Page, I believe, is still alive. He's about 94 or 95. I saw him about a year ago at Captain D's, and he was still kicking along. Great doctor, great doctor. But I was the kid that would go in there and they had to hold me down. I tore the paper off the bed. So I didn't like needles. older I get, here I am, fix me. I got something wrong, let's take care of this. Yes, it's going to hurt just a little bit, but I'm going to be so much better when it's over with, hopefully. But I got the hepatitis A. I was in Walmart, and they had this table there. I'm in all about free stuff, you know. So I saw this lady. She's from the state health department, and she was getting ready. She was packing up. We were getting at the end, and I'm like, I'm getting ready to miss a deal. Didn't know what she was giving away, but I thought, I'm getting ready to miss a deal here. So I walked up and said, hey, what's going on? So we talked for a moment. She said, we're doing this clinic for hepatitis A. She's from the state health department. It's an injection. You take this one in 6 months. 8 months later, you take another injection. You're good for life. I still need to get my life. I think this was back end of last year. I start to say February. No, I think it was probably about November, December, January. So I stick my arm out. Best shot I ever had in my life. I mean, she stuck that in there. I didn't even feel it. I'm like, man, I need to find her every time I need a shot. But I got my hepatitis A, and I'm getting ready. I need to go back and get my second dose of hepatitis A. I am a proponent. I do believe in vaccines. Now, for those of you anti-vaxxers out there, I'm not in for all vaccines, but the ones that have been medically proven, you see, over a period of time, I'm for that. I'm for helping. And there's, I'll probably get hate mail. Since these things are on YouTube now, you can laugh at me, make fun of me. It's okay. I understand that. It makes me a little nervous. I thought, man, I'm going to get fired before it's over with because I'm going to be unfiltered, and there it goes. Now, as long as I can eat, got a roof over my head, it don't matter. Everybody's healthy. That's you got to think of in terms of what's important in life. So, coffee, but no bloodborne pathogens. So we want to consider getting the vaccine. Ask your personal health care provider about that, health department, your pharmacist. Pharmacists can do great things now. I mean, well, they could do great things before. They filled your medications and they gave you your medicines and helped you understand the complications of your medicines or drug interactions with your other medicines, and they're a trusted part of the community. When I was in Danville, Kentucky, I was director of nursing in Danville, Kentucky for 7 years. Marlon Sparks was the owner, still is, of that facility. And Charleston Healthcare Center in Danville. Leaks Pharmacy, I believe it was, right across from me from the Dow Hospital, was the only it was my first seeing compounding pharmacy. That was so neat. I mean, they had an area that I was just blown away with that. Not every pharmacist or every pharmacy does compounding. Only certain pharmacies get into that type of business. But if you ever get an opportunity to see make pills, put medicine and stuff, that's pretty cool stuff. All right. There we go. So what are we going to do? If we get exposed to blood or other body substances, you're going to wash the area immediately. Wash it off. Report the incident promptly so we can do some follow-up care. Get medical help as needed. In your workplace. It's all covered by OSHA, the Occupational Safety and Health Administration. Ask about current treatments. What can I do for this? And I'm going to put this up there. There we go. Now, you've watched the other videos, and with this video and instructional information, there we go. I'll turn the page. And we're getting ready to see the test here in just a moment, but I'm going to put that on your canvas. You'll have a link, you'll hit it, you'll tape the test. After you're done with the exam, it will grade it for you. You'll see that. We want to learn all we can about infection control procedures and bloodborne pathogens because that will help protect us. Knowledge is power. We want to read the employers' in policies and procedures. We want to know what their exposure control plan is. We're going to contact our state and local health departments. We're going to consult your supervisor, our medical director, and infection control department, and then we'll call the CDC. We can call the hotlines. There's numbers here. I'm going to put that up here just in a moment. And we take precautions instead of chances. Take precautions. I think it was Benjamin Franklin that said, an ounce of prevention is worth a pound of cure. And that is certainly true. An ounce of prevention is worth a pound of cure. So if we can prevent it from happening, we're going to save not only money, but we're going to save possible misery with bloodborne pathogens and having to deal with that. Needle stick story that I had. Jenkins Community Hospital, little city in eastern Kentucky called Jenkins. They had a hospital at one time right across from the Hardys. Love that little hospital. 3 stories. The second floor and the third floor. The third floor was only open if they had an overflow of patients. They had a little 4 or 5 bed intensive care unit. Good community. There was a Johnson man, owns Johnson Industries. I think Greg Johnson's his name. He owned the hospital at one time. And Larry Disney, when I was there, he was the director of nursing. There was Dr. Nash, Dr. Parks, Dr. Friedline. Great people. Cared about their community, cared about their people. But I was there. We had a lot of coal miners. That's a coal mining town. And black lung, COPD, and they would come in, especially in the wintertime, flu and cold season. We had a lot of patients. So I was taking care of this gentleman. Long story short, try to make a long story short. I was taking care of this gentleman, and back then we didn't have all the fancy retractable needleless stuff. And a prior nurse, don't know who she was or he. Actually, I think I was the only man there, male nurse there, other than the director. They put an 18 gauge in a hep lock. Okay, an 18 gauge needle in a hep lock. Probably all they had at the moment, and they put it in there, and they were running fluid. I don't remember what it was, Solumedrol or something on a piggyback for an IV line, and they had taped it. Man, they had taped this thing good. So I have to change out the piggyback. It's time for some antibiotics. He may have some pneumonia or something going on. I can't remember. But so they had the tape, and the tape was stuck. So I'm pulling. I do not want to pull my heparin lock out, so I'm pulling on that thing and trying to get that needle out of that. And I had taken the tape off the best I could, and it had gotten warm and sticky. And so I did that, and it slipped. I was afraid I'd pull it all the way out, the needle, not the hep lock, because I had the hep lock secure with this hand, and I had the hep lock secure with this hand. And when I pulled it out, it come out so fast it scared me, so I put it back. And when I did, I missed the hep lock, and I went in right here, hit the bone, and went out the other side, because I bent that needle. And then I pulled it back out, and the blood started pouring. And I looked at that needle, and I looked at that, and I looked at my patient, and I said, I've stuck myself. I was feeling a little sick at this point. I said, I've stuck myself. I said, I need to go out and take care of this. Are you okay? He said, yeah. I said, I'll come back and help you. So I took my needle, I secured my needle, didn't want the patient to get stuck. And I walked to the nurse's station, sat down, and Vivian was there. I'm trying to think what Vivian's last name was. She was my charge nurse. And she said, what happened? I was white as a sheet. I had to put my head between my knees. Thought I was going to pass out. And I said, I've stuck myself with this needle. So, of course, I had to go to ER after she initially took care of me and did all that. So they wrapped up my thumb and everything, and I got my head between my legs. And here comes my little old patient. And he comes out with his IV pole, and he goes out, and he comes to check on his nurse. I guess he saw my face when I was stuck. And here I am. I got my head between my knees. I'm about to pass out from this needle stick. Having to go to ER. But our infection control people requested that if they would let them run a panel on him, and he said, sure, run anything. So he was clear, I was clear. I wasn't really worried, but it was, it was a thought. You had to go through the procedure. So I said all that to just a little personal experience of having a needle stick. All your procedures are in place to protect you, to protect the facility. They'll run panels. They'll follow up with you 6 weeks, 3 months, 6 months, a year, depending on what the conditions are for your situation. If your patient tested negative, if he allowed or she allowed to be tested, and they're negative, then other than maybe a side infection, then you're probably in really good shape. So just a little information there. So I'm going to hide the test. You say, well, Mr. Justice, you should show us the test. All right, there you go, guys. Learn all you can. See that guy there? Learn all you can about infection control procedures and bloodborne pathogens. Read your employer's instruction in your employer's exposure control plan, and take precautions, not chances. And that way we can be safe. Now, you're going to have give you a hint. There it is. Didn't get to see it, but it's coming. Remember, don't stress. You're going to have unlimited attempts at this. We want you to learn the information. We want you to be safe. In all this questionnaire it's 10 questions. It's all true and false. I'll read you one. Let's take just a moment and read you a test question. Number 1. I'll read number 1, 5, and 10. Infection control procedures only apply to blood exposure. True or false? The answer is false. They apply to many other body fluids, not just blood. There could be spinal fluid, a lot of other secretions that can come. All right, number 5. There is no need to cover cuts, scrapes, rashes when you're wearing gloves. Now, if you remember from the lecture and the book that we just went over, you always cover it and then you cover with gloves. All right, so that would be there's no need to cover. That'd be false. You do need to cover. Let's look at number 10. The bloodborne pathogen standard applies only to healthcare workers. True or false? False. It applies to everyone. The bloodborne pathogen standard applies to everyone. Now, let me see here just for a minute. So 1 was false, 5 was false, and 10 was false. All right, so I'm going to get this up on Canvas probably this evening or by tomorrow. I have to type all this in. And so this is your bloodborne pathogen lecture for this morning. This is for Medicaid Nurse Aid. This is also for Principles of Health Science. I've got another video coming. Be ready to watch it. And guys, have a good day. Stay safe. Have any questions, email me. Send me an email, and we'll answer those questions. Guys, thank you. Thank you for putting up with Mr. Justice. See y'all. Bye.